All right, we're on. Welcome to another Mouth Breathing Awareness Month episode. What I'm out here trying to do is do interviews with all of the amazing dentists and hygienists that I get a chance to meet through my MyoMentor program. So the whole idea is to spread awareness around mouth breathing and all of the things that go along with mouth breathing. From sleep apnea to thumb sucking to so much in between. These are the stories and the messages I'm trying to get out there. So today I've got Dr. Billie Adams, and I'm so happy that you're here. And I know you're going to share your story, kind of how you got into some of this myofunctional airway sleep stuff. And then I know you're also going to talk about maybe your boys, right?
Yes. Well, thank you so much, Sarah, for having me. And thank you so much for all that you're doing. It's so important for us all to have more knowledge in this area. Kind of just going and giving my story of how we met and how I was very fortunate to take your MyoMentor course. It's helped me a lot. So I'm a general dentist in Albuquerque, New Mexico, and we do cleanings, exams, fillings, crowns, but I do have advanced training in dental implants and durable medical equipment to treat some of the breathing disorders like sleep apnea. And then I also have advanced training in airway and TMD. And what I have found is they all kind of come together. One of the biggest pieces of this are those habits of breathing and the myofunctional aspect of it, the tongues, the lips. And so I think it's so important that all of us have awareness of how we breathe and just some of those postures. I know this is mouth breathing awareness. I usually like to talk to patients about open mouth posture. It's a little bit softer, right?
Yeah, people, you're right. I mean, we haven't really talked about that in any of the interviews, but most people will not admit, or they won't identify with actually mouth breathing, but they might say, yeah, my mouth is open sometimes. So I think I try to get people to see it doesn't have to be during the day. It doesn't have to be obvious. It might be only at night, or your lips might be just apart that much. But if you're breathing through your mouth, it doesn't matter if it's obvious or subtle. It's still happening.
Yeah, I think that's a great point. When I talk to patients, I tend to ask them, about 50% of the day, 25% of the day, do you feel the lips are apart? Because a lot of times we don't think of ourselves as breathing through the mouth versus the nose. I know that I run a lot, and I used to run, and a lot of runners do, we run with our mouths open. And so learning this concept of keeping the lips still during running is not easy, but it's definitely something that I've done to train myself. Because
have you?
I have, yeah. I was starting to see changes in my own face and in certain things. And really just making a lot of those changes has really helped. And so I think, as runners, we're healthy, we do all this, but we're not really paying attention. So it's kind of amazing. Some of the other training that I have is TMD. And I know that I deal a lot with, like really fit people, and they just have a lot of neck and head pain. And, when we talk about what they do day to day, and I'll find out that they are very active, and we talk about, what is your lip posture? Have you ever paid attention to it? And a lot of times they don't. And so I think just making people be more mindful about what they're doing and when they're doing, it's just really helpful. So
it's not normal to think like, what are my lips doing? How am I breathing? Like you do. And I talk about this through therapy with my patients, but like, it takes practice to check in and to change those things. Just kind of like head, neck, shoulder posture. Like it doesn't just happen. You have to like force yourself to check in. Like, what are my shoulders doing? How am I sitting? And you have to do the same thing with your breathing and lips and tongue and all that. Yeah.
I'm still working on my posture.
Me too. Oh my gosh.
That's always a challenging one.
Yeah. So maybe you can connect a couple dots between the TMD stuff, because I haven't had any of the dentists I've had on. We haven't really spent a lot of time on like TMJ pain, popping, clicking, whatever people might identify with their jaw joints. How does that relate to this discussion around mouth breathing and sleep apnea? Maybe you can connect some of those dots for us.
Yes, I'm gonna keep them just kind of brief because,
Yeah,
as
that's
you
good
know, they're
complicated.
really
Yeah,
advanced, right? We can talk about this all day long.
for
But when
sure.
we talk about TMD, usually patients have symptoms of pain in the face, the neck, or they may just have popping or clicking or dysfunction. And how they all kind of connect together is the lower jaw is attached by ligaments and muscles. And the lower jaw is kind of those borders around your airway. When you think about breathing through your nose and breathing through your mouth, that tube there is your airway. And so a lot of times when patients have problems with head and neck pain, they are often related. What I've learned through myofunctional is that sometimes it's a dysfunction that causes a lot of this pain. And yes, teeth are very important and they could be the cause, but also a lot of times it could be how we're functioning in this dysfunction that can be a big cause too.
Yeah.
So understanding the soft tissue in the mouth and the attachments of the soft tissue, and as well as the jaw structure and the joint itself, they all really work together. So I really have found that they all play special parts, and better understanding every part helps you treat patients individually and understand some
I
of their
know,
stuff.
gosh. Yeah, the whole tongue tie, tongue thrust, mouth breathing, the soft tissue stuff you're talking about, that has a huge influence on the TMJ joints, TMJs, and the function and the occlusion and everything else. So you can't really separate it all. It's one and
Yeah.
the same. And I love how you're helping your patients with that and talking about it. So
Yeah.
yeah. So what about, how did you go from helping your patients to now looking at your kids? Because I know you have
Yes.
two boys and
So
you've been kind of going through this stuff with them, right?
yes, exactly. So when you start seeing all this, you start seeing it everywhere and you can't help it.
Totally.
And of course, being a mom, you are always just looking at your children and you're trying to help them. And my boys are very different in the challenges that they have. And my oldest one, one thing early on, he was a big grinder when he would sleep, and I would be very concerned about that. And I knew there was always some airway component. Now that I've learned more about the myofunctional part of it, I do see these restrictions in what he can do. So even chewing, those people that have kids or work with kids, the kids that are always the loud chewers, and you're like, please close your mouth. Please
Yeah,
close your
smacking
mouth.
their food. Yeah, it's so true.
So those little things that we kind of see in them, and helping them chew better, swallow better. And sometimes it is their inability to breathe properly that they sometimes can't get past these. So being able to recognize when a patient has these restrictions, that you can either help with the myofunctional side of it, toning and training these big muscles to function together, or when the restrictions are too much and they have to be released, but kind of working together. Because when we think about it, it's the soft tissue that helps set and grow the skeleton. And so if we have these things so early on, we might start getting constricted skeletons. So we see crowding in teeth and we see changes. And so then even the soft tissue continues to develop and grow, and the space is so limited. And this is where we get back to some of our airway patients, the ones that have sleep apnea and can't breathe very well. So breathing is totally key.
Yeah. So how old is your son that you noticed the older one?
He is 6.
He's 6. So what are your, from your dental perspective and myofunctional perspective, what are you guys doing for his treatment or whatever?
That's a great question. We are actually working with Myo right now. And that has been, he's shown some great growth there. When I first started seeing this, I didn't quite understand every element.
Some videos and pictures and stuff, and you were saying I can't believe the changes actually, right?
Yes.
That's cool.
And he, speaking of open mouth posture, mouth breathing, he's very more on that side. And so we worked on lip seal. We've worked on swallowing. We worked on, he does have a restriction. And I do see that the arches are a little constricted. So we're working slowly, but it does take several different disciplines to help treat some of these patients. But right now we are really focusing on his myo.
Good.
Yeah.
And then what about the younger one? Because you said they're very different. So what do you notice with him, and what are you guys doing? How old is he?
So he's 4, and he's very different in that he's got more of, he's the skeletal class 2, but I don't see, and so what I mean by skeletal class 2 is his upper arch really kind of encompasses a lot of the lower arch. So it almost kind of cages the lower arch, so to speak. He doesn't seem to have a lot of dysfunction in his tongue. You know, he's got a lot of movement, and he doesn't grind, so he doesn't have these areas, but I'm just concerned about the arch development, and he's still a little bit young, so I am kind of taking his slowly. I see more of the restrictions in my older than my younger, but I see this skeletal class 2 that we all know in the dental world.
Like a deep bite, does he have?
A deep bite, yes,
Yeah,
yes,
okay.
where you see that the front teeth come over the lower teeth a lot stronger. And so from the dental perspective, and when we think about these patients that deal with airway issues later on, this right here is a class that we often get worried about.
Yeah, for sure. What I noticed from a myofunctional perspective is typically there's not an open mouth with a deep bite. A lot of times it's still nasal breathing, but the tongue posture is low. And a lot of times what they do is they brace the sides of the tongue between the molars.
Okay.
So the lips might be together, but the tongue is kind of splayed, like kind of between the molars. And obviously that affects how the teeth erupt and stuff like that. So I don't know, because I don't work with a lot of 4-year-olds, but the adults I see and the older kids that I see who have that bite, that tends to be their posture. So like tongue between the teeth, lips together. And so they still end up with a tongue thrust. They have a low resting tongue. It's just a little bit different, like posturing. So
do you think, question for you, do you think that it's more of a posture issue, or do you think there could be a deeper posterior tie that is preventing that posture? Or is it hard to say?
It's hard to say. I always think there's almost like 2 root causes of mouth breathing or myofunctional issues. One is a tongue tie, and one is like allergies, adenoids, sickness, like congestion. It's like, I think a root cause is often congestion, or it's a tongue tie. So just automatically it makes me think, well, if he's nasal breathing, if his mouth is closed, then maybe there is like a physical restriction with the tongue. But that's just a guess. I don't know. So, and then often the tongue restriction will lead to mouth breathing, and then they get large tonsils and adenoids anyways. So yeah, root cause, it's like kind of, hard to say, but no, at least you're noticing. And I always think it's so good for parents, to feel like, okay, even if we can't do anything today, at least we know these things. So as he grows and, gets older, now you can, go down the best path possible, at least with the knowledge, so.
Absolutely.
Yeah. Well, anything else you want to add?
I don't think so. I think we covered a lot.
Yeah, no, we talked about a lot. It was really good. And I think, you got a lot of really helpful information that I think will help patients. So, and that's the whole point. I want people to understand these concepts, because it's even hard for us dental people to understand. Like, these are not mainstream dental conversations and concepts, So I think, gosh, how do patients even get to the point where they understand these things? Because it's complicated for us. So
it is, yes.
Yeah. All right. Well, I'm going to share your stuff. So I want anyone in Albuquerque, New Mexico who needs a dentist, I want them to find you. So Dr. Billie Adams, her office or her practice is called Peak Family Dentistry. And you're kind of a holistic practice, right? What were you telling me?
Yeah, we definitely, we are overall health, and that's kind of wellness centric. So we definitely are looking at the whole body.
Yeah, I love that. I feel like we kind of have to start to move that direction in general with health, I think, if we actually want to get healthy. We have to, we can't just look at everything as a separate compartment.
And what a time, other than coming out of coronavirus.
I know. Oh my gosh.
Everybody has to get healthy. Everybody has to breathe better. Breathing is key.
Yeah. Oh my gosh, for sure. So thank you for sharing. Yeah, I can't wait for people to hear this. So yeah, I guess that's it.
All right.
All right,
We'll
talk
see
to you
you soon,
later.
Sarah. Thank you.
Oh, you're welcome. Bye.